Thank you, the Director of Ceremony. Let me take this opportunity to recognize the PPD Board Chair in absentia and the Vice Chair who is here present, and allow me to write on the protocol already observed. The health status of the people countries to be a matter of concern. The morbidity and mortality levels, especially of children and women, remain unacceptable. While governments in respective countries, especially developing countries, have committed themselves in international and regional agreements, the implementation of these commitments at country level remains uneven. Good morning, Excellencies, distinguished guests, speakers, ladies and gentlemen. I am delighted to be with you in this august meeting where we are gathered to foster high-level discussions on policy measures, challenges, and opportunities in integrating demographic trends into national development strategies to accelerate progress towards the International Conference on Population and Development and Strategic Development Goals in member countries. I would like to express my gratitude to the organizers of this event, PPD-UNFPA, and the government of the People of the Republic of Bangladesh through its leadership to accept to host this event. The government of Zimbabwe, through the Ministry of Health and Child Care and its coordinated agents, the Zimbabwe National Family Planning Council, is always committed to ensure provision of quality, integrated family planning and sexual reproductive health services. This is clearly indicated by, among other actions employed by the government. One, to enactment of the Zimbabwe National Family Planning Act of 1985, currently under review, to include current trends in the program. Establishment of the Zimbabwe National Family Planning Council, which is an agency responsible for coordinating and taking leadership in the provision of quality, integrated family planning and sexual reproductive health services. Establishment of family planning and sexual reproductive health services forums, and in the ICPD National Task Force being coordinated by the agents, clearly shows how the government prioritizes reproductive health issues, and in particular, family planning, sexual reproductive health services, a part of primary health care. Ladies and gentlemen, Your Excellencies, as you are all aware, ICPD Program of Action acknowledges South-South cooperation as a key strategy for achieving ICPD goals. The government of Zimbabwe joins others in the promotion and strengthening of South-South cooperation in reproductive health, family planning, and issues related to population policies. Through advocacy, policy dialogues, exchange of information and expertise, capacity building, and technical cooperation, Zimbabwe is committed to implement the ICPD Program of Action and the SDGs 2030 Agenda. The landscape of international assistance in recent times has changed significantly with the emerging economic countries. Many of them are PPD member countries, becoming international assistance recipients. In this regard, Your Excellencies, ladies and gentlemen, I would like to draw you back to the November 2019 Nairobi Summit ICPD 825, where South-South triangular cooperation was acknowledged as an alternative and sustainable financial tool for achieving ICPD and SDGs. Indeed, South-South cooperation promotes sharing of good practices and experiences and supports member states to realize their national aspirations and development goals in reproductive health, population and development. For example, Zimbabwe, among other member states, benefited from PPD scholarship programs offered with support from Egypt, India, and South Africa. This largely contributes towards the development of human resources based through skills development, leadership, and service delivery in reproductive health, population, and development. We believe in progress. We have global commitments like ICPD and SDGs, and we are worried about our future. People are suffering as a result of wars, conflicts, natural disasters like droughts, as in the case of Zimbabwe currently. Regardless of our thirst for development, let's not forget yet the devastating effects of COVID-19 pandemic on health systems globally, where resources were diverted away from reproductive health services, population and development programs to deal with the pandemic. The crisis is deepening on the international efforts to achieve the goals of zero unmet need for family planning, zero preventable maternal deaths, and zero gender-based violence and other harmful practices. In this regard, let us reaffirm our commitment to achieving the ICPD SDGs by 2030, moving our world forward and leaving no one behind. For us to achieve this, it is essential that there is a strong interaction, there is a strong international intergovernmental frameworks of promoting SSCs in advocacy, networking, and policy formulation. As I conclude, Your Excellencies, ladies and gentlemen, let me remind you all that partnerships are essential to achieving transformation. They can greatly assist in generating the magnitude of resources needed for implementing bold resilience developmental reforms. These previous developmental gains must not be eroded. The government of Zimbabwe remains committed to the work of PPD in collaboration with UNFPA and to promote South-South cooperation as an accelerator to achieving ICPD program of action and the 2030 agenda for sustainable development. I'm hoping for a fruitful engagement as we share best practices, experiences, and challenges, learn from each other's significant strategies and interventions employed to mitigate programmatic and policy challenges in our respective countries. I thank you.